Hi, this is Bill Bianchi, chair of PDA Chicago, speaking with Donna Smith of Sicko fame, and formerly of PDA Chicago, and now
one of the four national co-chairs of Progressive Democrats of America's Healthcare Not Warfare campaign.
Okay, very good. So tell us what's going on right now, Donna, with the Healthcare Not Warfare campaign. What are the priorities?
Well, one of our big priorities at the moment, of course, is our brown bag vigils that we're having the third Wednesday of every single month at noon in as many congressional districts as we can all across the country. In January, there were about 20. In February, there were more than 60. And in March, there were more than 90 brown bag vigils. So it's a growing movement where constituents are going in front of their district offices for their members of Congress and saying, no more war funding, and we want single-payer health care for all.
Okay, so it's reallocate the money from Afghanistan to health care.
Stop spending money killing people and start spending money healing people.
That's great. What do you think is the ultimate goal of this campaign? Where do you see it going to?
Well, I think it's to raise awareness among our representatives that we don't see the work as completed in healthcare on a national level at all. PDA has always advocated from the point of changing the Democratic Platform Committee language with a delegate from right here in Chicago working with us on the national level in Pittsburgh to get that language changed, all the way through to the point when we finally passed an improved and expanded Medicare for All program. PDA is going to be right there pushing these folks. We'd love to see more progressive Democrats in Congress. We need to elect more. We need to worry about November and push hard to make sure we have progressive Democrats. It's what we have right now. We need to push harder to have more progressive people to join Dennis Kucinich, join Bernie Sanders, and really give voice to this movement.
Let me ask you one of the tough questions now that's sort of hanging out there is, given that most or all of our members of the Progressive Caucus have voted for a bill and did not put their, demand a public option when it came down to it, do you think without going into the politics of that sort, do you think PDA's relationship or its strategy toward the Progressive Democrats needs to change or be altered in some way?
I think it needs to be altered in towards the Progressive Democrats to make it clear that we're disappointed with them, that if they had stood as strong as the Blue Dog Coalition did, as a matter of fact, maybe we would be standing in a different position with discussion of health care right now. But we also have some exciting energy coming forward out of this Congress, believe it or not. Congressman Alan Grayson of Florida put forward it's not what we want. I want to make that clear at the outset. However, he's opened the discussion with H.R. 4789 of extending the opportunity to buy into Medicare for everyone. And that at least gets us to the point of talking about Medicare for all. We don't need to reinvent the wheel.
Keeps the discussion about health care reform going.
Absolutely. He already has 86 co-sponsors on this.
Wow.
John Nickel reported yesterday, he was interviewed on one of the major radio programs, reported that at one point we were having a co-sponsor sign up one every 6 minutes onto that bill towards the end of this debate. That's how encouraging it is that people are now hearing the message of Medicare for all. It's definitely not the financing mechanism we want, but it's the message that we need to get across to these members. So we have a lot to be working on, a lot to build on, but we've got to make it clear, don't negotiate from a position of weakness. Don't put out there a weak strategy. You start with what you want, and what you wanted was to extend the basic human right of health care to every person in this country. You should have started with that position, not a weakened position from the beginning.
Okay, very good. There you have it with Donna Smith. Thank you so much.
Thank you, Bill, very much. It's awesome to be in Chicago. Chicago PDA is incredible. You guys, the growth today, this event was amazing. You guys should be very proud. Be a model for the rest of the country to put together their coalitions.